The physical, social, emotional, and spiritual challenges associated with life-limiting illness are often overwhelming for patients and families. For help, more and more Americans are embracing hospice care, a comprehensive medical program that supports terminally ill patients and their loved ones, and palliative care, an important service that helps people who are seriously ill but not yet at end of life.
So hospice is a special type of care that supports terminally ill patients and their families. When somebody is terminally ill, that means they have 6 months or less to live and that a cure is no longer possible. So as a consequence, the focus of our care is more about enhancing quality of life. And the care is provided by an interdisciplinary team consisting of doctors, nurses, CNAs, social workers, chaplains, volunteers, and bereavement counselors who care for the person holistically, meaning it's about caring for their body, their mind, their spirit, their soul, and their relationships.
End-of-life care is such a personal and emotional and spiritual process that it's really important that there's a good fit.
Advances in medical technology and treatments have added years to average life expectancy, but changed where and how most Americans spend that extra time. A century ago, most of us died suddenly at home with little to no warning. Today, however, most of us can expect to live several years struggling to manage a serious illness in a complicated healthcare system. This historic change has led many hospice organizations to offer palliative care to the community, a service designed to help patients and families live more comfortably and plan for what lies ahead.
So palliative care, or supportive care management as we call it here, is a type of care that helps support seriously ill patients and their families, folks who are struggling to manage the burdens associated with advancing chronic disease. Those burdens are typically physical in nature, but they can also be emotional and spiritual, caused by the uncertainty associated with not knowing what lies ahead as their illness progresses. So like hospice, palliative care is focused on ensuring the patient's comfort and helping them prepare for what might lie ahead.
Founded by volunteers in 1990 and located in Jefferson County, Wisconsin, Rainbow Hospice Care is dedicated to providing a wide array of programs and services that support patients and families throughout life's most challenging moments. Committed to bringing the promise of comfort, care, and meaning to those in need, Rainbow's highly skilled interdisciplinary teams provide relief to patients, families, and healthcare professionals alike, 24 hours a day, 7 days a week.
The mission of Rainbow Hospice Care is to provide comfort, care, and meaning at the end of life.
We were founded in 1990 by a small but dedicated group of volunteers who recognized early on that American medicine's success at extending life due to advances in medical technology and treatments had changed significantly where and how most people were dying. And they saw many families and patients struggling to navigate the murky waters of this new reality.
Rainbow cares for people living in their homes, assisted living facilities, nursing homes, and here at the Rainbow Hospice Care Inpatient Center in Johnson Creek, Wisconsin. Among the many services they offer are advanced care planning, supportive care management, hospice care, grief support, community health ministry, and Your Friends in Action, a volunteer program that provides neighborly assistance to the elderly and seriously ill.
I do grief support. And one of the biggest things that I love about the support I do is being able to help nurture hope for those that are dealing with difficult situations.
The last months and years of life can be an uncomfortable period for both the patient and the family because none of us know how to do end of life. Oftentimes that period can be accompanied by pain or frustration because the individual can't do the things that they've loved to do.
My dad had a series of strokes and a series of hospitalizations, and I found myself in the ER, and the ER doctor looked at me and said, "You need to put your dad in hospice." Fast forward, I picked the first one on the list, and Rainbow was the first one on the list, and I came to the IPC, and I walked in and burst into tears in front of Mindy Trebold, who's the director of social work here, and it was an amazing gift for our family at that time.
Rainbow Hospice Care has served the community well since 1990, and moving forward, we are excited to be changing our name to Rainbow Community Care. This new name better reflects the comprehensive services that we provide to ensure wellness and vitality through the aging process.
I'm not sure that there's a word that can accurately describe the level of care that my parents have gotten here with the Rainbow family. I guess I would use the word home. Really, it's the level of care that you would hope that you would get 24/7 all the time in your own home, and even things that you don't know.
Living with serious or terminal illness is inherently hard, but there are things we, as patients, families, healthcare professionals, and communities can do to make this part of life easier and more meaningful. Discover more today about Rainbow Hospice Care. We're here for you. To learn more about our services or to donate, visit rainbowhospicecare.org or call 920-674-6255.